Welcome to the NMU School of Nursing. Let's start our tour in room 1609 of West Science, which is known as the Reading Nursing Technology Center, or NTC. As you enter on the left, you see the main student workers desk. We employ up to 9 student workers each semester who help meet the needs of teachers and learners in our labs. The main area of the center is a space for students to work or study together in groups. There are 2 main exam rooms in the center that are used to practice health assessment skills or as pass-off space when students need to test off on skills. Moving on down the hall, we come to West Science 1613 and 1615, which is one of several of our nursing classroom spaces. The front of our classrooms consists of movable desks and chairs in order to accommodate different learning configurations. All classrooms have beds in the back. This classroom was just used by our foundation students who were practicing bed making and using easy lift devices. The instructor area has docking stations for computers and projectors to show videos or PowerPoint presentations. Each room has linen closets stacked with various supplies and sinks for hand washing. Now we're entering West Science 1614, which houses our Olive Pendle home suite. This area is used to practice caring for patients in a home setting and for a variety of simulation experiences. A popular simulation is the home safety simulation, where the room is set up for a variety of safety issues. There's a full bathroom in the suite to assess common safety issues that arise when bathing patients. We'll leave the classroom area to enter West Science 2612, which is the home of the School of Nursing Lab Simulation Center. As you enter, you'll see cubbies for students to stash their belongings, and on the right, a command center that allows instructors to observe and communicate with students from outside of the actual simulation rooms. We are fortunate to have 2 pediatric rooms and 1 family birthing room in our sim center. Each room contains high-fidelity simulators, mannequins, and equipment such as medication, dressing, and emergency carts. Rooms also have a space for debriefing experiences, which are a critical part of the simulation experience. This is our family birthing room. We have 2 computerized labor delivery and postpartum simulators, as well as a neonatal computerized simulator. The School of Nursing received a generous private donation from the Drake family after a nursing student came to the aid of Mrs. Drake when she suffered sudden cardiac arrest at a local restaurant. Thanks to the quick action taken by the student, Mrs. Drake made a full recovery after EMS arrived. In gratitude for helping save her life, the Drake family contributed to developing our new simulation center.